Welcome back to our channel. Today, we're delving into a topic that highlights the importance of proper nutrition and the potential consequences of overlooking a specific vitamin deficiency. In this video, we'll be exploring 7 irreversible complications caused by vitamin B12 deficiency. Before starting, we kindly request you to show your support by subscribing to our channel and turning on the notifications button. Vitamin B12 plays a critical role in various bodily functions. But what happens when we don't get enough of this essential vitamin? While the early signs of vitamin B12 deficiency can be subtle and easily overlooked, the consequences can be far-reaching. It can lead to several irreversible complications if left untreated or undiagnosed for a prolonged period of time. These complications primarily arise from the impact of vitamin B12 deficiency on the nervous system, cognitive functions, and red blood cell production. So, in this video, we'll explore the irreversible damages that can result from severe and untreated vitamin B12 deficiency, from neurological impairments to optic neuropathy and psychiatric disorders. We'll shed light on these often overlooked consequences. Number 1. Neurological damage. Vitamin B12 is crucial for maintaining a healthy nervous system. Prolonged deficiency can cause irreversible damage to the nerves, leading to neurological complications such as peripheral neuropathy, nerve damage affecting the extremities. The typical symptoms are numbness, tingling, loss of sensation, loss of coordination and balance, difficulty walking, muscle weakness, memory problems, cognitive decline, and even psychiatric disorders. Neurological damage is one of the most significant and potentially irreversible complications of vitamin B12 deficiency. 1.1 Damage or dysfunction of the peripheral nerves. Vitamin B12 deficiency can lead to peripheral neuropathy, which refers to damage or dysfunction of the peripheral nerves. Peripheral neuropathy typically affects the nerves in the hands and feet. It causes symptoms such as tingling, numbness, burning or shooting pain, and muscle. If left untreated, peripheral neuropathy can progress and lead to balance problems and even muscle wasting. 1.2 Effect on the spinal cord and brain. Prolonged vitamin B12 deficiency can result in a condition known as subacute combined degeneration, SCD. SCD affects the spinal cord and the brain, leading to a progressive degeneration of the myelin sheath, a protective or insulating covering of nerve fibers. Common symptoms of SCD include difficulty walking, loss of coordination, ataxia, muscle weakness, and sensory abnormalities such as numbness, tingling, or a sensation of pins and needles. If not addressed promptly, SCD can cause significant and irreversible damage to the nervous system. 1.3 Cognitive decline. Vitamin B12 deficiency has been associated with cognitive decline and psychiatric symptoms. Chronic deficiency can contribute to memory problems and difficulty concentrating. While these symptoms may be reversible with proper treatment, a long-standing and severe deficiency can lead to irreversible cognitive impairment and psychiatric disorders. 1.4 Vision impairment, caused by optic nerve damage. The optic nerve, responsible for transmitting visual information from the eye to the brain, can be affected by vitamin B12 deficiency. Optic neuropathy can result in vision problems, including blurred or double vision, decreased visual acuity, changes in color vision, and, in severe cases, vision loss. If optic nerve damage occurs due to vitamin B12 deficiency and is not addressed promptly, it can lead to permanent visual impairment. It's essential to recognize the early signs and symptoms of neurological damage associated with vitamin B12 deficiency and seek medical attention for proper evaluation, diagnosis, and treatment. If not addressed immediately, SCD can cause significant and irreversible damage to the nervous system. Prompt intervention through vitamin B12 supplementation can help prevent or reverse neurological complications and improve overall neurological function. Number 2. Pernicious anemia. Vitamin B12 deficiency can cause pernicious anemia, a type of anemia characterized by the inability to absorb vitamin B12 properly. If left untreated, pernicious anemia can lead to irreversible damage to the red blood cells, resulting in chronic fatigue, weakness, shortness of breath, and other symptoms associated with severe anemia. Number 3. Cognitive impairment. Vitamin B12 deficiency has been linked to cognitive impairment, including memory loss, difficulty concentrating, confusion, and even dementia. In some cases, these cognitive impairments may become irreversible if the deficiency is not addressed in a timely manner. Role of vitamin B12 in cognitive function. Vitamin B12 plays a crucial role in maintaining optimal cognitive function. It is involved in the synthesis of myelin, a protective covering around nerve fibers that facilitates efficient nerve signal transmission. It also participates in the production of neurotransmitters, which are chemicals involved in communication between brain cells. Adequate levels of vitamin B12 are necessary for proper cognitive processes such as memory, attention, and executive function. Cognitive symptoms of vitamin B12 deficiency. A deficiency of vitamin B12 can manifest as cognitive impairment and affect various cognitive domains. Common cognitive symptoms include memory loss, difficulty concentrating, confusion, and slowed thinking. These symptoms may be mild initially but can progress to more severe cognitive decline if the deficiency is left untreated. The good news is that cognitive impairment caused by vitamin B12 deficiency is often reversible with appropriate treatment. Once the deficiency is addressed through vitamin B12 supplementation, cognitive function can improve and symptoms can be alleviated. However, the extent and speed of cognitive recovery may vary depending on the severity and duration of the deficiency. Potential risk for dementia. There is some evidence linking long-standing vitamin B12 deficiency to an increased risk of developing dementia, including Alzheimer's disease. Cognitive impairment can have various causes, and vitamin B12 deficiency is just one potential factor. Other factors, such as age-related cognitive decline, other nutritional deficiencies, chronic health conditions, and lifestyle factors, can also contribute to cognitive impairment. A comprehensive evaluation by healthcare professionals can help identify and address all relevant factors affecting cognitive function. Number 4. Optic nerve damage. Severe and prolonged vitamin B12 deficiency can affect the optic nerve, leading to damage or dysfunction of the optic nerve, a condition known as optic neuropathy. This condition can cause vision problems, including blurred or double vision, color vision changes, and, in severe cases, vision loss. Optic nerve damage can be irreversible if vitamin B12 deficiency is not corrected promptly. Number 5. Psychiatric disorders. Vitamin B12 deficiency has been associated with an increased risk of psychiatric disorders, including depression, anxiety, and psychosis. Prolonged deficiency may contribute to irreversible changes in brain structure and function. Number 6. Stomach cancer. If you have pernicious anemia, you don't make enough of an intrinsic factor. That's a substance that helps your stomach absorb vitamin B12 from food. Studies show people with pernicious anemia have a higher chance of developing stomach cancer. The chronic inflammation and damage to the stomach lining may create an environment that is more conducive to the development of cancerous cells. Number 7. Infertility and the inability to stay pregnant. There's some evidence that a lack of vitamin B12 can make it harder to get or stay pregnant. It may also raise the chances that your baby will have a serious birth defect. With proper medical care, many women with pernicious anemia can have successful pregnancies and a healthy baby. And that wraps our discussion for today. Thank you for joining us. If you found this video informative, give it a thumbs up and share it with others who might benefit from the information. Don't forget to subscribe to our channel for more health-related videos. See you in the next one.